Hi everybody, this is John Adamson, the Rehab Documentation Guru, coming to you live from Waynesboro, Virginia. I just noticed I've got the mirror showing up my backside in the background as I'm holding my iPhone up. Anyway, today we've got two topics. We're going to talk about reasonable, and the second topic will be necessary as it relates to Medicare's definitions of the care that you're providing and helps answer the medical necessity piece of your documentation. So first of all, care should be reasonable. And there's a lot of things that fit into reasonableness. I'm going to just refer to my notes so I don't forget any of the points I wanted to tell you. First of all, is the care a normal standard of practice? In other words, it's not experimental and it has already been investigated already as being efficacious for what we're treating, for the diagnosis that we're going to be addressing. Number two, is the care an accepted frequency, intensity, and duration of care? So frequency, is it necessary to treat somebody 3 times a week? Is that reasonable? Is it necessary to treat somebody 5 days a week? Is that reasonable, depending on what's going on? For the intensity, does it take one CPT code or maybe multiple CPTs to address that issue? Or could it be something that's addressed with less intensity of care? And also, when you look at Part A, we're talking about rehab utilization groups. Is it acceptable to treat a patient with a certain diagnosis at a rehab ultra level or a rehab very level or et cetera? Or going to home health, is it reasonable to treat a patient beyond the 13th visit or beyond the 19th visit for a given diagnosis, because we know that the HERG is paid at a higher rate after we get past those levels? So that answers part of that. And then, of course, duration. What's the accepted duration for a patient, depending on what the patient's needs are? So that's the next question we have to ask about reasonable care. And then finally, and this really boils down to it, what's the return on investment? What do we give Medicare for the money that we've asked them to expend? So, for example, if you go to a store, let's take Walmart, for example, and I went to Walmart the other day, and a bag of conventional apples was going for 99 cents per pound. Of course, we're in the fall, so it is apple season. Whereas I went to Whole Foods earlier to pick up some food at their food bar, and I noticed that apples, conventional apples, were still running like $1.99 or for some $2.99. And so these are both conventional apples, and Walmart's selling local brand as well as Whole Foods. So in my mind, I'm wondering, okay, what is really reasonable for me to pay for? So that will help answer the reasonableness question as well. Are we getting a real good return on our investment? So one of the things that we're going to see in the future more of is Medicare will be managing the number of visits you're able to see based upon the patient's diagnosis. And that's partly why they're doing these G-code collection of information right now. So they'll determine, based on the improvements that you're making for the patient, the return on investment that they're giving you, what's an acceptable range of frequency, intensity, and duration of care. So something to keep in mind as we're documenting: are we providing reasonable care? Can we answer these questions of, are we using accepted standards of practice? Are we using an appropriate frequency, intensity, and duration of care? And then lastly, are we really giving a return on the investment, progress towards the goals that we're setting, which I'll talk about in a future installment of the Rehab Documentation Guru, about how to always have goals that progress towards something and show that you're giving a good return on investment. Well, that's reasonableness of care. My next video will be discussing necessity of care. Thank you for jumping on today. Please subscribe and look for future videos to cover essential elements of documentation that you need to know. Now, go out and get paid for what you do. Bye now.